It's Monday, March 21st, 2022. I'm Jonathan Lau, and this is 5 Minutes of Proof, a weekly analysis of the science behind ozone therapy. Today, we're going to dig in again to the Madrid Declaration on ozone therapy. We're going to start on page 21, hopefully get through the rest of the document prior to the annexes. So let's go ahead and jump in. What we're going to take a look at first is just this, contraindications. So when you get into contraindications on ozone therapy, I always say it's generally blood disorders where there's lack of clotting, lack of platelets. You got toxic hyperthyroidism, thrombocytopenia significantly, and then coagulation disorders on top of that. So there's a number of things, though, massive and acute hemorrhaging, where you just want to be careful. Ozone improves blood flow qualities. So if you have a bleeding disorder, it's something to consider and just to be more judicious with. Pregnancy, they say, has seen good results, but there is a warning, of course, every time there's pregnancy. That's the case. Interactions with ozone. I think this is significant. I get a lot of questions. In fact, I talked to somebody yesterday about this. What if you're taking antioxidants, high vitamin C or glutathione, or even just oral vitamins and antioxidants? They say they should never be given during treatment, but only after ozone therapy. This is a change from previous versions of the Madrid Declaration. The concern is that ozone can oxidize and inactivate. We're jumping down actually into talking too about homeopathy, vitamin C, glutathione, mixing ozone with those products before you put it into the body. And the concern is that will oxidize and inactivate them. But you can do high vitamin C or other types of vitamin antioxidant treatments. Just do it after the ozone therapy. They get into adverse effects, and they talk about grade 1, grade 2, grade 3, and grade 4, just individual cases for the most part of where grade 5, where ozone in different studies, and mostly not in studies, but in real life, had an effect, a negative effect. So you can read through those. There's not much that lines up every time as a side effect. So take those things with a grain of salt a little bit. But certainly you can have negative reactions at times. Be aware of that. Toxicity, don't inhale it, of course. They talk about pediatric doses by rectal insufflation. So you can look at those charts here. Then they go into main routes of application. We're not going to really hang out there at all because we talk about that in different areas. So you've got things like major autohemotherapy, and they'll walk through, the normal ranges and talk about a little bit about why, and a few notes to consider. Frequency of treatment. Same thing for minor autohemotherapy. Main indication on that one is dermatological diseases. I just wanted to bring that to light. And they say the cycle is 5 to 10 treatments once a week. So I thought that was interesting. Ozonated saline solution, again, that's new for this version of the Madrid Declaration. They say it's feasible. You can do it. They have different ways to do it, but the dose is so small, 1 microgram to 5 micrograms, that I personally question whether or not that's actually an effective dose of ozone. Some people would say no. Some would say yes. Something called EBU, extracorporeal blood oxygenation ozonation. That's something you can look at, basically dialysis with ozone, really low concentrations. Got rectal insufflation, of course, 10 to 35 micrograms. So keep it fairly low concentration-wise. Vaginal insufflation, of course, is another option as well. So, and then you get into things like intramuscular injections, perivertebral injections, lots of injection type things, and you can read through some of that on your own time. We don't have time to go into all of it now. I know I'm just jetting through all of this really quickly here. They talk about limb bagging, and you can go up to 80 micrograms on that, down to 20, depends on where the healing process is. So be aware of that. You're going to want to use the right concentration at the right time. For the eyes, for the ears. By the way, we have an ear ozonated oil coming out here in a couple weeks. That's going to be really cool. So lots of different ways to apply ozone, obviously trigger points, ozonated creams topically, and oils. So that's a great way, easy way to do it. And then we get into just talking about water and looking at oil and looking at peroxide levels and levels of ozone in fluid. So you can be aware of that as well. Application routes not recommended of being safe. DIV. We've talked about DIV before here at O3 Vets. Application routes prohibited. Inhalation. Don't want to inhale ozone. Application routes that have not received total consensus. Injection of ozonized water. Injection of ozonized glucose solution. I didn't even know that was really a thing. Hyperbaric multipass method, HBO3, which is high dose ozone therapy, definitely can have a toxicity effect because of the amount. Intraperitoneal ozone, they say in that one, it is actually a valid way to do it. It's done in animals that way, so be aware of that. Then they go into grades of recommendation. So level A, B, and C, as far as the disease processes that we're treating. Level A is, man, we see really good scientific information on this. Level B is fair, and level C is, there's fair evidence there, but we don't have a lot on it. So things like spinal disease, knee osteoarthritis, plantar fasciitis, diabetic foot ulcer on level A. Then you get into things like painful disorders of musculoskeletal tissue, dental caries, periodontal disease, osteomyelitis, acute chronic infections in level B. Number of other things as well that you can take a look at there. A lot. And then we get into level C, and basically it covers the gamut of all the different diseases at some point in time in those three levels. And then they talk a little bit more about just in general quality controlling ozone therapy, all that type of thing. But that is it. Then we're into references in the appendices. So, all right. Thank you. This has been 5 Minutes of Proof. We'll see you next week.